we want to introduce the modified suture technique called continuous sewing machine-like suture technique. As we know, the different part of meniscus can choose different suture methods, inside out, outside in, all inside, and so on. This is the traditional all-inside sutured hook technique of the meniscus root tear with the traction suture or lasso, which requires repeated sutures and tractions. Here we made some improvements to make it more convenient and faster. We call it continuous sewing machine-like suture technique. Different from traditional suture hook technique, in our modified technique, sufficient length of suture-free end needs to be left outside the suture hook, as shown in this figure. This is the example. We use suture hook loaded with traction suture to finish twice continuous sutures. After the first puncture, the suture-free end outside the hook is pulled out, and the suture and hook are not separated. The next puncture is continuously proceeded. More than that, in our modified technique, the suture hook can be directly loaded with high-strength suture. As the picture shows, sufficient length of high-strength suture-free end needs to be left outside the suture hook. The picture shows the example of patient position and the arthroscopy approaches. First, we explore the posterior root tear of the medial meniscus through anterior medial and anterior lateral approaches. And then the medial auxiliary approach is established. Then we begin our continuous twice suture procedure. Use the suture hook loaded with high-strength suture. The suture process is further simplified without traction procedure, just like a sewing machine directly sews the thread. Our technique can also be used in meniscus centralization and make it more easier without repeated tractions. The puncture site can be freely selected. Another improvement of our modified technique is that the suture times can be increased more than 2 times. Here we show 3 times continuous sutures of the medial meniscus root tear as an example. Different from twice continuous sutures, for 3 or more times continuous sutures, the free end of the suture outside the suture hook needs to pass through the loop formed by each suture as the video shows. Just like the working principle of a sewing machine, we can freely select different suture parts for continuous suture according to different meniscus injury types, forming different knot-shaped structures and suturing the meniscus into a complete and firm body.